Bariatric surgeons from around the country and overseas have come to Fresno Heart and Surgical Hospital each fall for the past 3 years to hear its experts lecture on revision surgery and teach during live surgeries. Fresno Heart and Surgical's bariatric program has been rated 5 stars by Healthgrades, and it tops hospitals in California for the number of bariatric procedures it does. The reputation of the hospital's metabolic and bariatric surgery program draws both patients and other surgeons.
We do get, foreign doctors and residents who come and visit us here in Fresno because they want to kind of learn and see how we do things. I think we have a world-class program here, and we're very fortunate to have that, and we're happy to be able to provide education for other surgeons.
During the 2-day conference for bariatric surgeons, lectures and discussions were about why patients need resurgery and the best ways to help them lose and maintain their weight. New techniques and research were also shared and debated.
This is a course that's more on revision surgery, and there are new procedures being done, so each time there's a new procedure being done, we're going to talk about revision of a new procedure. In some patients, the anatomy of the surgery can be fixed or helped with a revision surgery. Sometimes the nutrition from one of the older surgeries is very poor from the malabsorptive types of surgeries, and so we can convert those into a healthier type of weight loss surgery. We have some new procedures like the gastric plication, which is basically folding in the outside or greater curve of the stomach and making a narrow tube. Instead of cutting the stomach off, it folds it in.
One new development has been the FDA approval for the use of band, the adjustable gastric band, in patients with lower BMIs who do have comorbidities, including diabetes. That's the big medical problem that a lot of obese patients have. And so we're starting to see that patients who do not meet the old criteria but do have diabetes can benefit from weight loss surgery.
I think what you're seeing with this course here is we have a spectacular international faculty, but we also have a spectacular international group of surgeons here that have a great experience. And so the lectures are fantastic, but I think the discussion between all the participants is even more educational.
As predicted, we have reached consensus on almost no topics thus so far, so that's probably okay.
Data shared and debated during the conference looked at how different types of revisions can work on the mechanisms that lead patients to regain weight.
There are a lot of operations, and the basis of most of our operations is to take away the hunger. And that's a powerful tool, so you can get full and still be hungry, which is interesting. That's why we eat so many desserts. And if we study our morbidly obese patients, our patients before surgery, 65, 75% of them have nutrient deficiencies going into surgery. Overweight, nutrient deficient, which is really quite interesting.
Surgeons present also debated whether bariatric revisions should be done for patients who have regained weight, mainly because they fall back into poor eating habits, rather than because they experience an anatomical issue that needs correcting.
I think with revision surgery, society, the medical community, insurance companies like to, blame patients. Patients failed. Patients failed the diet, they failed surgery, they're just failures. And that's not the case at all. But you think about any other chronic disease. If you have cancer or diabetes or blood pressure, and you're treated, and the treatment stops working or fails, do they say, well, too bad, no more, you've had your shot, done? No, of course not. So why is the treatment of morbid obesity any different? It's a lifelong commitment to a lifelong disease, and surgery is the most effective treatment. And if it loses power and someone needs more help, why not offer them a secondary operation? We owe it to them to keep on trying.